Hello everyone, this is Chadi Alraies from ARCH 2023. I'm really privileged to be today with George Chrysant, who is on the planning committee for ARCH. George, thanks for being with us. We just finished a peripheral session. You are chairing the peripheral session, but also we spoke about PE, the pulmonary embolism, and VTE in general. So what is up to date in 2023?
So the session, what we try to do to be a little bit more innovative is discuss not only how to create, a pulmonary embolism team, but to talk about the latest tools and techniques and trials and offer some case-based examples, because there's a lot of subtlety in pulmonary embolism. Younger people can mask the disease a lot more than older folks, and so there's a lot of nuance, and so every year we try to add a little bit more and just try to keep everybody as up to date as possible.
So that's perfect. But one thing I noticed is there's a big variability in treatment of VTE in different systems. You spoke about you are moving away from PERT team, you already finished that, but there's some systems are still struggling to launch a PERT team. So what do you think as a PERT consortium or in general, what do you think to make kind of homogenize the therapy across the board? What should be done?
Yeah, so I think that part's difficult because this is truly a situation where local politics are local. So if you don't have certain capabilities like ECMO or like CT surgery on site, then they can't really be part of your PERT team.
Right.
So in those situations, you have to alter how you go about things and maybe have a partnership with someone who can offer those advanced therapies if you need them, and have some sort of synergistic relationship there. And so that's something we also talk about, and Dr. Rosenfeld's presentation today was great in terms of showing the ideal situation and then understanding that that ideal situation doesn't always exist. So you work with what you can work with.
Yeah, something like similar to pharmacoinvasive therapy,
right?
Like where you give something and then transfer to a higher level of care for more advanced therapy.
Exactly.
So what is new now for pulmonary embolism?
Well, I think the thing that's new now is we've got several ongoing trials, and we have the emergence of newer technology, newer catheters that are able to aspirate even more thrombus while maintaining a profile that is acceptable.
Yeah.
And so making the procedure easier, and that makes it easier on patients.
Right.
And so, so it's basically just advances in techniques while we wait for the results of these trials.
Yeah, and the evolution is similar to the TAVR. Before was the most intimidating thing is the access. And now you take care of the access, then the procedure becomes so easy and the profile is smaller. It's becoming done in smaller centers.
Yeah, the safety of the catheters is really impressive when you think about it, and that's really what's enabled us to handle more and more patients safely.
Right.
Yeah.
Well, George, thank you so much for your time, and thanks for sharing a phenomenal session. Please watch these videos and others on ARCH YouTube channel. This is Chadi Alraies from ARCH 2023. George, thanks so much.
Thank you.